Good morning, students. Last class I told you about fracture, kinds of fracture, treatment of fracture. Today I will tell you dislocation. What is dislocation? Our body has several joints or bones which sometimes on heavy tension leave their original place. This is called dislocation. Symptoms of dislocation. Joint place causes much pain, swelling appears, joint them cannot move the least, shape of the limb become ugly, the unnatural. First aid. Console the patient and keep him in rest position. Keep bandage of cold water or ice or on the joint. If cold water does not work, give formation of warm water. Take the patient and at once to the doctor. First aid. Shoulder dislocation. First aid, let the patient tie at ease, remove the garments clothes from his arms, give him tea or warm milk to drink, put cold water bandage on joint. If he does not feel comfort, give warm fermentation. Call a competent doctor. Collarbone dislocation mostly happen with infant. First aid. Put a cloth or cotton pad in his arm. Immediate treatment begin. Call some expert doctor. Elbow dislocation. Keep the hand on chest turning from elbow. Hang the hand in a small sling. Call immediately any expert doctor. Jaw dislocation. Try to tie bandage from jaw to head. Call the doctor. Let the patient lie comfortably. Arm dislocation. Let the patient lie on his back. Send him to doctor by a stretcher. Tension of muscles symptoms. Great pain in sitting and standing straight. Any movement in body towards much pain. The pain. Check breathing in pain. First aid. Give hot fermentation on the spot. Keep the dislocated spot comfortably. Take doctor's advice in great pain. Sprain. It is also occur in the pivot types of joint due to sudden fluctuation or under pressure. Sometimes the tissues and ligaments leave the attached bony structure and they develop a swelling. In such case, the spot becomes bluish and is very painful for the patient. In the case, patient should be kept in comfortable position and the area should be fermented with ice cold water. Sprain relievers and other creams should be applied gently on the affected spot. Symptoms of sprain. The place where joint leave the tissues get swelling, the spot grows bluish, in movement of the spot the patient feel much pain. First aid. Keep the spot comfortably tightly tie a cold water bandage in if possible and necessary give cold water and hot water treatment alternatively. Wounds due to hurt. What is wound? Due to hurt when any spot of limbs break and blood comes out, it is called wound. Kinds of wound. Inside wounds treatment. And sometimes knife blade or lead cut any limbs of body and wound becomes there. Treatment of inside wounds. First of all, clean your hands and press the wounds. It is wash the wound with Dettol. If the wound is big, if the bleeding continued, tie the joint little away from the wound to check the bleeding. If the wound is very large, get it assessed by a doctor. Lacerated wound. It becomes by the hurt of brick, stone, stick. Treatment. Wash the wound with some antibacterial medicine to remove dirt etc. of the wound. Tie over it with bandage. Try to check the unseen of the bandage. Unbroken wound. Such types of wound does not seen broken or cracked from outside. The treatment can be provided as allow Punctured wound. These wounds are come by punching of needles, crochet, pointed instrument, etc., which are very harmful to the blood vessels. Treatment. Clean the wound and take the patient to the doctor. Wash the wound with antiseptic liquid. Put mercury, chrome and cotton. Tie the wound with a bandage. Gunshot wound. The bullet of rifle, pistol, revolver, stain gun often goes across the body and make a dreadful, dreadful and serious wound. Treatment. Take the patient to the doctor at once. Hit the bullet in left in the body. To check the bleeding, wash the wound with antiseptic liquid. Should and tie the doctor over the wound with cotton piece. If the bullet in the body, sprinkle cold water on the face to keep him to sense. I think you understand your chapter. Now I will tell you your exercises. Fill in the blanks. You are given in options. Check the correct answer. Select the correct answer. Very short answer given here. And a short answer type question. Question number 1. Give any two symptoms of a sprain. It is on page number 233. Ball cavity joint in page number 234. What is the basic difference between fracture and dislocation? Page number 229, 2232.